One of the biggest challenges facing our world today is the rising tide of non-communicable diseases, often referred to as NCDs. These diseases, which include conditions like heart disease, stroke, diabetes, chronic respiratory diseases, and cancer, are the leading causes of death globally. But what exactly are non-communicable diseases? What are their causes and risk factors? And most importantly, how can we prevent them? Join us as we delve into the causes, risk factors, and preventive measures associated with these conditions that claim the lives of millions worldwide. Let's start with a simple yet crucial question. What are non-communicable diseases? Non-communicable diseases, as the term suggests, are diseases that cannot be transmitted from one person to another. Unlike communicable diseases such as tuberculosis, malaria, or the flu, which are spread through pathogens, NCDs are typically long-lasting and develop over a period of time due to a combination of factors. The four major types of non-communicable diseases are cardiovascular diseases, cancers, diabetes, and chronic respiratory diseases. However, it's important to note that the term NCD encompasses a wide range of other conditions, including mental health disorders and neurological disorders. One of the defining features of NCDs is their chronic nature. Unlike acute conditions that are short-term and self-limiting, NCDs are long-lasting and may persist over a person's lifetime. This chronicity means that individuals diagnosed with NCDs require ongoing medical care and management to control symptoms and prevent complications. For example, people with diabetes need to monitor their blood sugar levels regularly and manage their diet and physical activity to prevent complications such as heart disease and stroke. Similarly, those with chronic respiratory diseases like asthma need to take medications and avoid triggers to control their breathing difficulties. Another crucial aspect of NCDs is that they are not communicable. This means that they cannot be spread from one person to another through direct contact or the exchange of bodily fluids. Instead, NCDs arise from a complex interplay of genetic, physiological, behavioral, and environmental factors. This non-communicable nature of NCDs highlights the importance of individual responsibility and lifestyle choices in their prevention and management. Unlike communicable diseases, which can be addressed through public health measures like vaccination and disease surveillance, NCDs require a more personalized approach. Understanding the risk factors and making informed lifestyle choices are essential in reducing the likelihood of developing these conditions. In addition to their chronic and non-communicable nature, non-communicable diseases also exhibit a diverse range of conditions. As mentioned earlier, the main types of NCDs include cardiovascular diseases, cancers, diabetes, and chronic respiratory diseases. Cardiovascular diseases encompass conditions affecting the heart and blood vessels, such as coronary artery disease, heart failure, and stroke. Cancers, on the other hand, involve the uncontrolled growth and spread of abnormal cells. Diabetes is a metabolic disorder characterized by high blood sugar levels, while chronic respiratory diseases encompass conditions affecting the airways and lungs, such as asthma and chronic obstructive pulmonary disease. This diversity in the range of NCDs reflects the complexity of these diseases and the need for specialized care and treatment for each condition. Each type of NCD has its unique set of risk factors and requires specific management strategies to effectively address the underlying causes and provide appropriate medical interventions. Understanding what causes NCDs and the factors that increase their likelihood can empower us to make informed choices and take preventive measures. Non-communicable diseases typically arise from a complex interplay of several factors. Genetic factors play a significant role, as some individuals may be predisposed to certain NCDs due to their family history. Physiological factors related to natural processes within the body, such as hormonal changes or aging, can also contribute to the development of NCDs. However, it's important to note that NCDs are not solely determined by these factors. Behavioral factors such as poor diet, lack of physical activity, tobacco use, and excessive alcohol consumption play a major role in the onset and progression of many NCDs. For example, a diet high in saturated and trans fats can increase the risk of heart disease and stroke, while a sedentary lifestyle can contribute to obesity and diabetes. Additionally, environmental factors such as exposure to certain pollutants or living in areas with limited access to fresh fruits and vegetables can also play a part in the development of NCDs. It is crucial to consider the interplay of all these factors when addressing the causes of non-communicable diseases and implementing preventive measures. By understanding the specific risk factors associated with each type of NCD, individuals can take proactive steps to reduce their risk and maintain good health. Non-communicable diseases pose a significant global health challenge, accounting for the majority of deaths and disability worldwide. According to the World Health Organization, who NCDs claim the lives of 41 million people each year, representing 71% of all deaths globally. The leading types of NCDs responsible for the highest number of deaths are heart disease, stroke, chronic respiratory diseases, and diabetes. Furthermore, the economic impact of NCDs is substantial. The cost of treating these conditions, lost productivity, and disability associated with NCDs place a significant burden on individuals, healthcare systems, and economies worldwide. The global economic cost of NCDs is estimated to be in the trillions of dollars annually. This highlights the urgent need for effective strategies to prevent and control non-communicable diseases on a global scale. Addressing the root causes, promoting healthy lifestyles, and providing accessible healthcare services are crucial in mitigating the impact of NCDs on individuals and societies worldwide. Having explored the global impact of non-communicable diseases, let's now shift our focus to the prevention of these conditions. While there is no cure for most NCDs, adopting a healthy lifestyle can significantly reduce the risk of developing these diseases. One of the cornerstones of NCD prevention is eating a balanced and healthy diet. This includes consuming plenty of fruits, vegetables, whole grains, and lean proteins while limiting the intake of saturated and trans fats, added sugars, and salt. Regular physical activity is also crucial in preventing NCDs. The recommended amount of exercise varies, but generally adults should aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strengthening exercises targeting all major muscle groups 2 or more days a week. Additionally, avoiding tobacco use and limiting alcohol consumption are essential in reducing the risk of NCDs. Tobacco smoke contains harmful chemicals that damage blood vessels and increase the risk of heart disease and stroke. Excessive alcohol consumption can lead to liver disease, high blood pressure, and other health problems. By adopting these preventive measures, individuals can significantly reduce their risk of developing non-communicable diseases and promote overall health and well-being. In conclusion, non-communicable diseases represent a major global health challenge, causing millions of deaths each year. Understanding the causes, risk factors, and preventive measures associated with NCDs is crucial for individuals and healthcare professionals. By adopting a healthy lifestyle, including a balanced diet, regular physical activity, avoiding tobacco, and limiting alcohol consumption, we can significantly reduce our risk of developing these chronic conditions. It's essential to prioritize our health, make informed choices, and seek regular medical checkups to detect any potential issues early. Remember, knowledge is power, and taking proactive steps towards preventing NCDs can lead to a healthier life. So educate yourself, take charge of your health, and live a life that minimizes the risk of non-communicable diseases. Thank you for joining us on this informative journey. We hope that this video has shed light on these prevalent conditions and inspired you to take proactive steps towards your health. Remember, small changes in your daily routine can make a big difference in preventing NCDs and promoting overall well-being. Stay healthy, stay informed, and continue to learn about the fascinating aspects of health. Until next time, take care.